You've heard me talk about enhanced primary care from the folks at Delphi Healthcare. Andy Vailas, the chief officer there, but he's joined by one of his doctors. I'm going to let Andy run with this because I've been urging you to check this out. The website, Delphi, DELPHIHC.com. Become a member today because for what it would cost you and your significant other to go out to dinner, have a few appetizers and maybe a gratuity, guess what? That you can't do that for $120 a month, one dinner. But unlimited access, no stress, personal time with your doctor. It's what it should be. Andy, take it away. Good morning. Thanks for being with us.
Good morning, Jack. Thanks for having us. I'm here with Dr. Calegari. I'd like to have Dr. Calegari give some insight as to why we started this and how it benefits patients.
Hey, doctor. Thanks for being with us.
Hi, Jack. Thanks for having us on. Appreciate it. So I know you spoke with Andy before, so we just started this about 2 months ago, and we're excited. It's been growing, and it's been exceeding our expectations. I've been a primary care doc in the area for over 25 years, and the climate of primary care now is such that the push is numbers, and it's less time with patients. So for me personally, I was looking at starting a practice where I would be able to spend more time with patients, and eventually we hope to add more physicians that have the same philosophy. But it's been very well received. Patients get about an hour appointment each. They have plenty of time to talk about their issues. And as a primary care provider, I feel like I have enough time to spend with them and less time doing paperwork. And at the end of the day, we get it done.
Now, contrast, Doctor, Andy and I have talked about this, and I know you were in a bigger healthcare setting, and you don't have to say the names out of respect. But
Sure.
As a doctor, correct me if I'm wrong, doctor, I have friends who are, like yourself, doctors. And you know what they've told me starting about 10 years ago? They don't have as much fun making people and helping people get better as they used to because they're just swamped with too many patients all at once. I don't think it serves the doctor or the patient well, so doctoring isn't as fun. But it's not fun being a patient when you feel like you're just a number and you never know who you're going to see. And the doctor, during the whole appointment, staring at a laptop, trying to get you out of there as quickly as possible. I'm not saying there's not good doctors and PAs and nurses, but I think you know what I'm getting at.
Sure. Yeah, I mean, that's kind of what's going on. I think I have a lot of colleagues of mine that are in the same situation. They're all trying to figure out how to make it work. I mean, we all got into this business to help patients, and, the bottom line is that's our goal, is to help the patients. But, for many reasons, many reasons that probably over the past several years, there's just been more paperwork. The electronic medical records are clumsy. Everything has to be documented to a T. There's a lot of insurance kickbacks and prior authorizations. There's a lot of stuff that goes on behind, the scenes. And so it takes away from that time you would have to spend with the patient. So everything you said is very accurate, and it's very unfortunate because we need good primary care. It's sort of the entryway into the system. It's hard for patients to navigate the system without a good primary care that has a network of specialists that he or she can refer to. So it does start with the primary care provider, and like you said, it's just been bogged down with paperwork. And I mean, that's kind of that's one of the reasons why I wanted to start this with Andy and Nick, is we really felt that we could do a better job for patients, and
Yep.
I think people are very happy with it.
Do you find yourself, because you've been doing it a while, you're up and running, I know people are signing up, I know listeners have, and I'd urge people, go to the site now, DelphiHC.com, DELPHIHC.com. Sign up today, because not only just the cost is so affordable, but you're going to get excellent access to your primary doctor who actually knows you. And it might be a text message back that morning saying, tell me about your sore throat. It might be a phone call. It might be an appointment that day. But sign up now. Go to the site. Are you finding, Doc, that you're enjoying the practice a little more? And not saying having fun. Work is work. I mean, sometimes people are really sick, and I'm sure it's not always without feeling that. But are you enjoying the ratio, I guess, the mix a little more?
Oh, for sure. Yeah, I mean, just to put it in perspective, where I was before, I was probably seeing maybe 16 to 18 patients a day, starting the day at, 6:30, 7 in the morning, working mostly through lunch and getting home around 7:30 at night. Those were the tough days. So now I'm seeing, anywhere between 5 to 8 patients. We've had a fairly busy couple of weeks, but very manageable. We have plenty of time to spend with patients and plenty of time to do that extra paperwork so that, the day is not so long, but more importantly, patients are getting what they need.
Well, but more importantly, doctor, I don't want to speak for you, maybe Andy can weigh in. The patient leaves feeling like they had meaningful time with their doctor. I mean, if it takes 40 minutes, it takes 40 minutes. If it takes 14 minutes, it takes 14 minutes. If it takes an hour, it takes an hour. But they feel like they weren't rushed.
Absolutely.
Yeah.
Yeah. One thing, Jack, I want to add is Dr. Calegari and our other physicians have the ability, even beyond just the office visit, to have touch points with the patients, and then also help them get to see the specialists that they need beyond primary care. We're not associated with the hospital system. We're an independent practice, which then costs are less. But at the same time, we have our doctors have the ability to get people where they need to go. There's a misconception that people need to be associated with a hospital system to see specialists and to get services, but that's really not the case. If there's a good thing about today's world and technology, it makes it a lot easier with getting referrals out and getting people the treatment that they need. And because Dr. Calegari and others have more time on their hands to be able to treat these patients, because, again, they'll have less patients. They're going to be capped at 600. Dr. Calegari could speak to this. He had anywhere from 1,500 to 2,500 patients at his practice, and that alone just is unreasonable for doctors.
Yeah, go ahead, doctor, if you want, because I had one more question. Go ahead.
Yeah. I got, I probably had about 1,500 patients, but like when you age adjust, and sometimes hospitals will age adjust, we had a lot of Medicare patients, so that just takes a lot more time. You can't squeeze, an elderly patient, whether they're Medicare or not, into a 20-minute visit. So a lot of these patients needed 45 minutes to an hour. So age adjusted close to 2,000 patients, but, technically, 1,500 to 1,600. But, yeah, it's unfortunately it becomes unsustainable, and that's it's not just me. There's many people out there that are feeling the burn.
Yeah, and again, I just think it's so affordable, and it's sort of taking the stress out. Andy, speak to the cost a little bit and the access and the wait times.
Well, absolutely. I mean, we're $120 a month, or you can pay $1,200 for the year. And I know a lot of people are already struggling with the cost of health care, but people need to understand that we're paying for insurance, and insurance is what covers the care. It's not what gets you care. This program basically guarantees you care and not having to wait 3 weeks, 4 weeks, even several months to get an appointment. We've had patients call us or sign up with us on today, and then we'll see us today or tomorrow or whenever they need. Talking to our patients, they're blown away that they get to actually choose the day that they want to come in versus us telling them the day they have to come in. If people want to call us and discuss what their options are or how this works, they can reach out to us at 603-255-5579. We have a team happy to take calls and discuss the program as a whole. But again, it's about access. It's access to your doctor when you need them.
Yeah, and again, I'm just looking at the numbers here, and this is for adults to start. Same-day appointments most often. It's affordable, and it's, Doc, I'll let you end this. I share on my show when I talk about how healthcare has become kind of a racket, and we just feel like we're a number out there. There wasn't many years ago when we lived in the greater Manchester or Bedford area where you're headquartered, where I'd go to my primary care doctor for that physical once a year, or if you had a wrinkle during the year, an issue. And he'd always say, he's retired now, because it was before this change where they've come all about the numbers. He'd sort of say, hey, how's the family? How are the kids? How you been? And you felt like you knew the guy. You knew the person,
Mm-hmm.
and he knew your history. Do you feel that way with your patients? You get to know them?
Oh, for sure. I mean, I think these guys can probably attest to it. I'd say a lot of my patients are, I have friends that are my patients. We have neighbors that are our patients, and I've been in the community for over 25 years. So that's the best part of primary care, is really getting to know the patient. because they tell you what's wrong and you figure it out. You just need the time and you need to build a relationship with them. And this is, and I had that where I was before, but I'm going to be able to do that a little bit more and focus more on getting things done for people. And you just, when the numbers are low, you can do it much better, and that's the bottom line.
All right, Andy, if people want to learn more, sign up today and join. Best way is how?
603-255-5579 is the best way to call us. Again,
one more time. One more time slowly on the number.
Yep. Our phone number is 603-255-5579. Or if you'd like to sign up right away, visit delphihc.com. That's DELPHIHC, as in healthcare.com. And people can choose their doctor and sign up right away.
All right, that's great stuff. I appreciate it. Good, thank you, doctor. And I know you're going to be growing. DelphiHC.com. Thank you.
We have room for you, Jack.
Thank you very much, Doc. I no offense, I like to stay away as much as possible. Usually, you're the ones call. I'm going to tell you a funny story though, because do you mind a healthcare anecdote? I used to love doing this with Nick. They always about laughing. I know I'm not easy, and I know I don't fit in every box, but I'm older than Andy and probably you, and I try to take good care. You never know. Health is wealth. That's a Vailas line. And so I got, what is it? I'm getting old. As I get older, I'm trying to get, it'd be great to have no prescription medications. That's a goal, right? And so I hadn't been for a year or so. Actually, I hate to lie, a year and a half to my primary care. And the office called saying, you really are not on any medications. We haven't seen you. We need to see you. And I go, if I'm not sick, isn't that a good thing? Why do you need to see me? And she's almost making me feel guilty that I got to get in there for any medications I need. They can't just call them in, and you got to get in here. We haven't seen you in a year and a half and 2 years. I go, at my stage in life, you should be sending me a candy bar saying, keep it up. If you don't have to see you, it's like your vehicle. I mean, you should keep it. I know you got to maintenance, but I just had to laugh.
Right.
They were giving me a hard time saying, you got to come in once in a while. I go, well, I don't want to. All right. Thank you, Doc. All right.
All right. Thanks a lot.